If you're over 60 and taking calcium or vitamin D every day, this video could change everything you think you're doing right. Because there's one critical vitamin most seniors are missing, and without it, calcium may be hurting your heart instead of helping your bones. Doctors rarely talk about this vitamin, yet it controls where calcium goes in your body. Miss it, and calcium can end up in your arteries instead of your bones. Today, I'll explain why vitamin K2 is the missing piece most seniors don't know about, and why taking calcium without it can be a serious mistake. Most seniors have never even heard of vitamin K2, and that's not their fault. For decades, doctors talked about calcium for bones and vitamin D for absorption, but almost no one explained what actually tells calcium where to go inside the body. That job belongs to vitamin K2. Vitamin K2 works like a traffic director for calcium. It activates specific proteins that guide calcium into your bones and teeth, where it belongs, and keeps it out of places where it can cause damage, like your arteries, heart valves, and kidneys. Without enough vitamin K2, calcium doesn't disappear. It simply goes to the wrong places. This is especially dangerous for seniors because calcium supplements are widely recommended after age 60. Many older adults take calcium faithfully every day, believing they're protecting their bones, but without K2, that calcium may slowly harden their arteries instead. One reason vitamin K2 deficiency is so common is diet. Years ago, people ate more fermented foods like aged cheeses, traditional butter, and fermented vegetables. These foods naturally contain vitamin K2. Today, most seniors eat far less of them, especially if they've been told to avoid fats or cholesterol. Another major reason is medications. Many seniors take cholesterol-lowering drugs, antibiotics, or acid-reducing medications. These can interfere with vitamin K2 absorption or reduce the gut bacteria that help produce small amounts of K2 naturally. Aging itself also plays a role. As we get older, our digestive system becomes less efficient. Even if a senior eats foods containing vitamin K2, the body may not absorb it as well as it once did. This means deficiency can develop slowly and silently over time. What makes this especially concerning is that vitamin K2 deficiency doesn't cause obvious early symptoms. You don't feel pain, you don't feel tired. There's no warning sign that says calcium is quietly building up in your arteries instead of strengthening your bones. By the time problems appear, they often show up as serious conditions. Arterial stiffness, heart disease, kidney stones, or worsening bone density despite taking calcium for years. Many seniors are confused when they hear this. They ask, if calcium is supposed to help my bones, why are my scans getting worse? Or, why did my doctor say my arteries are calcifying even though I'm doing everything right? The answer often comes back to vitamin K2. Calcium alone is not enough. Vitamin D helps absorb calcium into the bloodstream, but vitamin K2 determines where that calcium ends up long-term. Without K2, calcium can become more harmful than helpful. In the next part, I'll explain exactly what happens inside your arteries and bones when vitamin K2 is missing, and why seniors are at much higher risk than younger adults. When calcium doesn't go into your bones, it doesn't simply leave your body. Instead, it begins settling in places where it should never be, especially in your arteries. This process is called vascular calcification, and it's far more common in seniors than most people realize. Your arteries are meant to be flexible. They expand and contract with every heartbeat, allowing blood to flow smoothly to your brain, heart, and organs. But when calcium builds up inside the artery walls, those vessels slowly become stiff and narrow. This stiffness raises blood pressure, reduces circulation, and forces the heart to work harder. Over time, this increases the risk of heart disease, stroke, and heart failure, even in seniors who believe they're doing everything right with supplements. Here's where vitamin K2 becomes critical. Vitamin K2 activates a protein called matrix GLA protein, or MGP. This protein's job is to bind excess calcium and prevent it from sticking to artery walls. But without vitamin K2, MGP remains inactive. It's there, but it can't do its job. So calcium sticks, layer by layer, year after year. What makes this dangerous is how silent the process is. Arteries don't hurt when they calcify. You don't feel warning signs early on. Many seniors only discover the problem after a scan shows hardened arteries or after a cardiac event occurs. At the same time, bones suffer. Inside your bones, calcium needs another K2-activated protein called osteocalcin. Osteocalcin pulls calcium into bone tissue and locks it in place, making bones stronger and denser. Without vitamin K2, osteocalcin stays inactive. That means even if you're taking calcium every day, your bones may not be using it properly. This explains a frustrating reality many seniors experience. They take calcium for years, yet their bone density scans stay the same or get worse. Calcium is present. Vitamin D helps absorb it. But without vitamin K2, the final step never happens. Instead, calcium drifts into arteries, joints, kidneys, and soft tissues. This is why seniors may develop kidney stones, joint stiffness, or arterial calcification while still being diagnosed with osteoporosis. Age makes this imbalance even worse. As we get older, the body becomes less efficient at regulating minerals. Hormonal changes, reduced kidney function, and chronic inflammation all increase the likelihood that calcium will end up in the wrong places. This is also why seniors are more vulnerable than younger adults. A 30-year-old with flexible arteries and strong bone turnover may tolerate mineral imbalances better, but a 65, 70, or 80-year-old cannot. Another issue is dosage. Many seniors are told to just take more calcium when bone scans worsen, but increasing calcium without addressing vitamin K2 simply adds more material that can calcify arteries. More calcium is not the solution. Better calcium direction is. This is why some doctors are now rethinking long-standing supplement advice for seniors. The focus is slowly shifting from how much calcium to how calcium is used. In the next part, I'll explain how vitamin K2 works together with vitamin D and why taking vitamin D alone may not protect seniors the way they expect. Many seniors believe that if they're taking vitamin D, they've already solved the calcium problem. After all, doctors often say vitamin D helps your body absorb calcium, so it must be enough. But this is where a dangerous misunderstanding happens. Vitamin D and vitamin K2 do very different jobs. Vitamin D's main role is to increase calcium absorption from your intestines into your bloodstream. In simple terms, vitamin D raises calcium levels in your blood. But once calcium is in the blood, vitamin D's job is done. Vitamin D does not decide where calcium goes next. That decision belongs to vitamin K2. Vitamin K2 activates the proteins that guide calcium into your bones and keep it out of your arteries. Without K2, vitamin D can actually make the problem worse by increasing calcium in the bloodstream with no proper direction. This is why some seniors take vitamin D faithfully for years, yet still develop arterial calcification or worsening bone density. More calcium in the blood does not automatically mean stronger bones. In fact, when vitamin D is taken without enough vitamin K2, calcium may circulate longer in the bloodstream and increase the risk of depositing in soft tissues. This is especially important for seniors because aging changes how the body handles minerals. As we get older, our kidneys are less efficient at filtering excess calcium. Our arteries are stiffer and more vulnerable to calcification, and our bones don't rebuild as quickly as they used to. So the margin for error becomes much smaller. This explains why younger adults can often take vitamin D alone without obvious issues, while seniors may experience problems over time. Another issue is dosing. Many seniors are advised to take high-dose vitamin D, sometimes 2,000, 5,000, or even 10,000 IU daily. Vitamin D levels rise, calcium absorption increases, but vitamin K2 is rarely mentioned or measured. So calcium floods the system with no traffic control. This imbalance may contribute to higher risks of arterial stiffness, kidney stones, and calcium buildup in joints problems often blamed on aging, when in reality they may be driven by improper supplement balance. It's important to understand this clearly. Vitamin D pulls calcium into the body. Vitamin K2 puts calcium where it belongs. They are partners, not substitutes. Taking vitamin D without vitamin K2 is like opening the front door for calcium but giving it no instructions once it enters. This doesn't mean vitamin D is bad. Vitamin D is essential, especially for seniors, but vitamin D should not be taken in isolation when calcium intake is high. This is why some doctors now recommend considering vitamin K2 alongside vitamin D, particularly for older adults who take calcium supplements or have a history of cardiovascular issues. However, not all vitamin K is the same. Vitamin K1, commonly found in leafy greens, helps with blood clotting. Vitamin K2 is the form that directs calcium metabolism. Many seniors eat vegetables regularly and assume they're getting enough vitamin K, but vitamin K1 does not perform the same function as K2 when it comes to bones and arteries. Understanding this difference is critical. In the next part, I'll explain which seniors may benefit most from vitamin K2, who needs to be cautious, and how age, medications, and health conditions change the equation. Not every senior has the same risk when it comes to vitamin K2 deficiency. Some older adults may benefit greatly from it, while others need to be more cautious and informed before making changes. Understanding which group you fall into is critical. Seniors who are most likely to benefit from vitamin K2 include those who take calcium supplements regularly. If you've been advised to take calcium for bone health, especially after age 60, vitamin K2 becomes far more important because it helps ensure that calcium is used properly. Another high-risk group includes seniors with low bone density or osteoporosis. If your bone scans are worsening despite years of calcium and vitamin D, vitamin K2 deficiency may be part of the reason. Without K2, calcium may never fully integrate into bone tissue. Seniors with cardiovascular concerns may also be affected. Arterial stiffness, plaque buildup, and calcification become more common with age. Vitamin K2 plays a role in activating proteins that help protect arteries from calcium buildup. This doesn't mean vitamin K2 cures heart disease, but it may help reduce one major contributor to arterial calcification in older adults. There's also a group many people don't think about: seniors who eat very low-fat diets. Vitamin K2 is fat-soluble, meaning it requires dietary fat for proper absorption. Seniors who avoid fats completely may absorb less K2 even if small amounts are present in their diet. Now, let's talk about who needs to be careful. Seniors taking blood-thinning medications, especially warfarin, must be cautious with vitamin K2. Vitamin K directly affects blood clotting pathways, and sudden changes in vitamin K intake can interfere with how these medications work. This does not mean vitamin K2 is automatically unsafe for these individuals, but it does mean supplementation should never be done without medical guidance. Another group that needs caution includes seniors with advanced kidney disease. Calcium and mineral balance is already delicate in these individuals. Any changes to supplements should be monitored closely to avoid complications. This is why one-size-fits-all supplement advice is dangerous for older adults. Some seniors hear about vitamin K2 online and immediately add it without understanding their personal situation. Others avoid it completely out of fear, even though it might help them. The right approach is informed and individualized. Age alone doesn't tell the full story. Your medications, medical history, diet, and current supplement routine all matter. This is also why doctors don't always bring up vitamin K2. Medical guidelines move slowly, and many physicians were trained at a time when vitamin K2 wasn't well understood. That doesn't mean they're wrong, it means the science is still evolving. For seniors, the goal is balance, not extremes. Calcium without K2 may increase long-term risks, but K2 without proper context can also cause confusion if medications or conditions are involved. The key takeaway here is awareness. If you're a senior taking calcium or vitamin D, vitamin K2 is something you should understand, not blindly take, but understand. In the next part, I'll explain how seniors can think about vitamin K2 safely and practically, what questions to ask their doctor, and what mistakes to avoid when adjusting supplements. For seniors, the goal with vitamin K2 is not to chase another supplement trend. The goal is to understand how it fits into the bigger picture of calcium, vitamin D, and overall aging health. Vitamin K2 is not something you take blindly. It's something you consider carefully, based on what you're already taking and how your body is changing with age. The first thing seniors should think about is their current calcium intake. If you are taking calcium supplements daily, especially in moderate to high doses, vitamin K2 becomes more relevant. Calcium needs guidance, and vitamin K2 helps provide that guidance. If you're not taking calcium supplements and get most of your calcium from food, vitamin K2 may still matter, but the urgency may be lower. The second factor is vitamin D. If you take vitamin D regularly, especially higher doses, vitamin K2 deserves attention. Vitamin D increases calcium absorption, which makes proper calcium placement even more important in older adults. This doesn't mean every senior must take vitamin K2. It means seniors should be aware of how these nutrients interact. The third factor is symptoms and history. If you've experienced kidney stones, arterial calcification, stiff arteries, or declining bone density despite supplementation, it may be time to ask deeper questions about calcium balance, not just calcium quantity. This is where conversations with your doctor matter. Instead of asking, "Should I take vitamin K2?" a better question is, "I'm taking calcium and vitamin D. How do we make sure calcium is going where it belongs?" That opens the door to a more thoughtful discussion. Another important point is consistency. Seniors should avoid making frequent changes to supplements without monitoring. Sudden increases or decreases in calcium-related nutrients can disrupt balance, especially in older bodies that adapt more slowly. Changes should be gradual, intentional, and monitored over time. Diet also plays a role. While supplements exist, vitamin K2 is naturally found in certain foods, such as fermented foods and some dairy products. However, modern diets often lack these foods, which is one reason deficiency is common. That said, diet alone may not provide sufficient K2 for some seniors, especially those with absorption issues or restricted diets. This again reinforces the idea that context matters. There's also a common mistake seniors should avoid, assuming more is better. More calcium is not better. More vitamin D is not always better, and more supplements do not automatically mean better health. Balance is what protects seniors long-term. Vitamin K2 is about direction, not force. It doesn't push calcium harder, it helps place it smarter. Finally, seniors should remember that supplement needs change with age. What worked at 55 may not work at 70. What felt fine at 65 may feel different at 80. Reevaluating supplements every few years is not weakness, it's wisdom. In the final part, I'll summarize the key takeaways for seniors, explain what truly matters most when it comes to calcium and vitamin K2, and help you walk away with clarity instead of confusion. If there's one thing seniors should take away from this video, it's this. Calcium is not the problem. The problem is where calcium ends up as we age. For years, many older adults have done exactly what they were told. They took calcium for their bones. They added vitamin D to help absorb it. They followed the advice faithfully. Yet bones continued to weaken. Arteries became stiffer. And confusion grew. Vitamin K2 helps explain why. It doesn't replace calcium. It doesn't replace vitamin D. It helps complete the system. Vitamin K2 activates the proteins that tell calcium where it belongs into bones and away from arteries, heart valves, kidneys, and joints. Without it, calcium can quietly build up in the wrong places over time, especially in seniors. This is why taking more calcium is often not the answer, and why taking vitamin D alone may not fully protect you as you get older. For seniors, health decisions are rarely about extremes. They're about balance, context, and timing. Vitamin K2 is not something to rush into blindly, but it is something seniors should understand, especially if they take calcium, vitamin D, or have concerns about bone or heart health. The most important step is awareness. Ask better questions. Look at the whole picture, not just one supplement, and remember that your needs at 70 are not the same as your needs at 50. Aging bodies require smarter support, not stronger force. If this video helped you understand something your doctor never explained, share it with another senior who may be taking calcium without knowing the full story. And remember, the goal isn't chasing supplements. The goal is protecting your bones, your heart, and your quality of life as you age. Thank you for watching, and I'll see you in the next video.